I just said there the thyroid plays a very important role in our body. Just exactly what does it control and regulate?
Well, the question should be what does it not control and regulate? Virtually every cell in the body, from your cells from your hair to the tip of your toes, requires thyroid to actually just basically function and live. It affects the very core of your metabolism, and that it helps generate energy from those little parts of the cell called mitochondria, which is basically like powerhouses of the cell. So it requires thyroid hormones to actually function properly and generate all the energy that's needed for day-to-day activities of life.
So if the thyroid is not working properly, I know some of the symptoms can be fatigue, you can have constipation, it could be hair loss, could be irritability, anxiety. I mean, the list just goes on and on.
Right. So just because the symptoms and signs of low thyroid state is so widespread and varied, it sometimes becomes difficult to diagnose if you don't think about it.
Mm-hmm.
So we recommend as a matter of routine, when patients first come to my clinic, I check the thyroid functions as part of their general hormone profile, always.
And low thyroid, far more common than the other side of that, which is an overactive thyroid. We'll talk about that in just a minute. And women suffer thyroid problems far more than men.
This is true. Women suffer thyroid problems far more than men. Some kind of a genetic variation, I suppose, because of the X chromosome, most likely. And also the women go through pregnancy, which actually changes the demand for thyroid hormones, etc. That being said, the symptoms voiced by women are often ignored because I guess most of the guidelines are written by men.
Yeah. So one of the things that you need to do is a blood test. And what are you actually looking for in that blood test?
We are actually looking for suboptimal levels. In other words, there is no such thing as a cutoff or a normal or abnormal, though the American Thyroid Association will tell you that a TSH level of 3 is anything more than 3 is considered low thyroid. TSH, of course, goes in the opposite direction of thyroid. It's an indirect measure of the thyroid hormones. Then we measure the T3 and the T4 as well, the free levels of T3 and T4. But we don't just stop there. We also measure thyroid antibody levels to see if there's an autoimmune process going on. And if all these are still normal, but the patient has a lot of symptoms of low thyroid, which is definitely possible, we give them what is called a trial of therapy with thyroid hormones. In other words, we try you for a month or two. If we get better, then we have our diagnosis. If we don't get better, we take it off.
And that's one of the things that I know about your practice is a little bit different, is you're not paying attention just to the labs. You pay a lot of attention to what the patient's telling you.
Right. Ultimately, we are in the business of treating patients, not in the business of treating lab values. So the patient's symptoms always trump the lab values.
So you mentioned TSH a moment ago, and that's thyroid signaling hormone. Now, see if I've got this right. My body sends out this signal that says, the TSH, that says, hey, Mr. Thyroid, I need some juice here. And so when I'm doing a lab test, and if all I look at is that TSH, if the TSH is in that right level, then doctors assume that I'm okay, right?
Yeah, so the TSH is in the right level. You can assume that the thyroid gland is actually producing thyroid hormones normally. However, that doesn't doesn't account for the fact that the thyroid hormones that are being produced may not be actually effective. So that's the second part of the story that needs to be told. As Paul Harvey would say, we need to know the rest of the story.
The rest of the story. Well, we'd like to have you as part of our story this morning, so jump on the phone at 447-1190 or 800-333-1190. If you have questions about thyroid challenges that you may be facing, it's a hereditary condition, and as we said just a moment ago, millions of people suffer. They're not properly diagnosed and treated, and maybe that's what's going on with you if you don't feel quite right, so it's a chance for you to find out more. So low thyroid is far more common hypothyroidism. The other side of that is your thyroid's in overdrive. What are the symptoms I'm going to see with an overactive thyroid?
Yeah, the symptoms of an overactive thyroid are typically excessive fatigue, muscle wasting, disturbances in your vision, weight loss. And this weight loss comes despite having a great appetite. So they can eat all they want, but they keep losing weight. almost an ideal situation for many people, I'm sure.
Right.
But in the process of losing weight makes you also very sick. The fatigue is tremendous. And lack of focus and lack of concentration, insomnia, excessive sweating. These are all symptoms of excessive thyroid.
Do we know what causes a thyroid to go out of whack?
Right. There are specific things in the body known as the immune system called thyroid antibodies, and there are different types of antibodies. So if you have more of the stimulating kind of antibodies, you get hyper or overactive thyroid, and if you have more of the blocking or the negative type of antibodies, you get hypo or underactive thyroid. Hyper and hypo sound very much the same, so you have to be careful. I just tell them it's over or under.
Yeah, that makes a lot of sense. So if I am either side of that equation, well, if I'm hypo, if I'm under thyroid, you're going to give me a supplement to kick that into gear. Tell me about that process.
Yeah, so when you're underactive hypothyroid or hypothyroid, normally the standard of care, or what is commonly prescribed, is something called levothyroxine. It goes by several brand names, such as Synthroid, Levothyroid, Tirosint. It basically has a chemical compound called T4. It's called T4 because there's 4 iodine atoms around the tyrosine base. So that is what is commonly prescribed. What we prescribe in the clinic is oftentimes a combination of T4 and T3, because remember, the T4 is an inactive hormone. It needs to be converted by the body into something called T3, which is the active form of the thyroid hormone. And sometimes, most of the conversion happens, 80% of your T3 comes from the peripheral conversion or conversion of the T4 in the liver, muscles, heart, and all the other areas. So if you don't have the conversion ability, or if it gets impaired for various reasons such as endocrine disruptors, pollution, stress, you can have all the T4 in the world, but you still have you'll suffer the consequences or the symptoms of hypo or underactive thyroid because the T4 is not being converted into T3.
So I'm taking my thyroid meds, but my body can't convert that T4 into T3, and therefore I still am deficient.
Correct. So you're actually T3 deficient, which is actually the true definition of hypothyroidism, is the body's inability to process T3.
Okay. And that's where you will prescribe that T3 as well as the T4.
Correct. And there's, of course, another little bit nuance here, that you may have enough T3 in your system, but that T3 may not be entering the cells. And after entering the cells, it may not be binding to the thyroid receptor in the nucleus. And then even thereafter, after binding to the thyroid receptor, there is something called thyroid hormone resistance. The receptor itself may be insensitive. So you require a higher dose of T3.
So you get why just taking some of the meds occasionally and is not going to really maybe resolve your problem. It's something you have to follow up on, track, and measure.
That's correctly, because the problem with current approaches, if you take the position that I'm only going to give my patient T4 or Synthroid, you are probably missing out on a large number of patients that have enough T4, but they just can't process and convert that or utilize that into T3. So it would be too simplistic to assume that all low thyroid states can be treated by one pill, which is T4 or Synthroid.
So how common is it that I can't sleep, so I'm taking a sleep aid, but my problem is really hyperthyroidism, or, walk that through? All of those symptoms could be medicated or treated by another solution when they're not really getting to the core of the problem. Yeah,
now you're talking about the overactive state, right? The hyperthyroidism. Yeah. So when somebody comes with insomnia, obviously you first take a detailed sleep history. Are they exercising? What's the diet like? Is it something recent, or has it always been there? If it's been something more recent, then obviously it's more significant, more likely to be hyperthyroid. And then what are the other symptoms that go along with it? Do they wake up refreshed? Okay, or are they having trouble falling asleep or staying asleep? Do they snore, for example? Could it be sleep apnea? So there are a lot of things that need to be ruled out before we say it's hyperthyroidism. But that hyperthyroidism is relatively simple because the blood test will reveal that. Mm-hmm. In fact, the blood test of hyperthyroidism is even more definitive than for hypo, because it's much more clear-cut in overactive states than it is in the underactive state.
That makes a lot of sense. You can easily tell the thyroid is working too hard. There's too many other factors on the other side of that.
Actually, the tests are skewed towards better diagnosing the overactive state than the underactive state.
Glad to have you back with us. We are talking today about your thyroid gland, this little butterfly-shaped gland that's right in the front of your throat, but it has a huge impact all across your body when it is not working well. And that's what our guest specializes in. He is Dr. Ashoka Dombey of Fort Wayne Endocrinology. So we were talking earlier about the fact that low thyroid, hypothyroidism, is far more common than others. And you sometimes will prescribe a trial of T3 in addition to T4, which kind of makes your practice a little bit unusual. Is there any downside, any risk to that at all?
There is no risk to the patient, for sure, but there is a risk to the doctor. In the sense that sometimes the state medical boards and the powers that be take a very hardline stance on prescribing a thyroid compound containing T3. Now, if you adhere to the guidelines, they are guidelines. They also make a disclaimer saying that they're not to be construed as statutes or as absolutes. However, having said that, various state medical boards and various especially state medical boards, some of the states, hopefully not in Indiana, but in other states that I have had the opportunity to defend doctors on, they take the stance that the guidelines are absolutes and they are like statutes. They must be followed, and any deviation from the guideline would amount to substandard medical care, which is completely false. It's kind of hard to convince sometimes the medical boards. So by definition, doctors are being sort of in a way coerced into prescribing only T4 or Synthroid or levothyroxine. There is perhaps a lot of bias that goes into formulating the guidelines. I was on the guidelines committee for testosterone many years ago for American Association of Clinical Endocrinology, AACE. The way the guidelines are designed is a committee is formed, and those committee members, 6 or 7 or 8 or 10 of them, they sit down and decide what's good for everybody else, which is very unscientific way of doing things. And even, for example, the normal value of T4 or TSH is very arbitrarily determined. There's no science behind it. It's very statistical. There's no real evidence based behind saying a certain range is normal and a certain range is abnormal.
So I know an ongoing issue for particularly postmenopausal women is controlling weight. How often is that a thyroid-related condition?
Oftentimes it's not the only reason why they don't lose weight, but it could be a very strong associated factor why they may not be losing weight. In other words, if a woman is clinically hypothyroid, I don't mean the TSH levels, but I mean by symptoms and by metabolism and other signs and symptoms of low thyroid, the woman can starve all she wants. She's not going to lose a pound, and that's because your body adapts. Because of the hypothyroid state, there's no energy being generated in those mitochondria we talked about that generates energy using thyroid. So if there's no energy being burnt, no energy being generated, your calories not being burnt, your metabolism has come to a screeching halt. And short of really concentration camp kind of diets, you're not going to get weight loss. Okay, and that's a very unhealthy way of going about it.
So is that alone, that inability to control my weight, is that alone a reason to be screened and potentially treated?
Short answer is yes. The long answer is it depends. You need to look at other factors as well.
Okay.
But you can't miss it. You have to be aware of it.
So if I'm postmenopausal and I cannot lose weight, and I've been told that, no, your thyroid is fine, your thyroid levels are fine, I'm confused. What's going on here?
Yeah, your thyroid levels may be fine, but your metabolism may be not fine. In other words, we can use thyroid, what is called an off-label use. Prescriptions for that are prescribed for reasons other than what it was originally approved for. It's perfectly legal, perfectly legitimate to use medications off legal, except for growth hormone. It's perfectly legit to use any medication off-label, and growth hormone is the only exception. It was passed by special law of Congress not to use it off-label, but we can use thyroid off-label, but that has to be documented in the chart and the thought process, so that in case charts get reviewed And part of the problem is that the people that consume the healthcare don't pay for it. Someone else is paying for it, and then someone else pays for it. Then it's subject to a lot of regulations and scrutiny. And one of the things is, they frown upon off-label use of medicine. So if you use a thyroid off-label, yeah, you can use it off-label, and actually it's also quite cheap to do that. It costs maybe about not more than $10 a month for a prescription for thyroid or something like that.
So you might prescribe that as a trial to see, does a thyroid supplement help me manage weight? And then how long am I going to? What's a valid period to test?
Yeah, we would test the patient back typically in about 6 weeks or so. To see whether they have improved or what's happened to the blood work. So the blood work shows higher levels, and this document they voice clinical improvement. Then we keep them on it. Okay.
And again, that's all down to talking with the patient, seeing how they feel, how you're responding, and not looking at the labs alone.
Right. It's that's a fine art between juggling between the labs and the patient's symptoms. So you need to do both.
What is a dead giveaway that I have a thyroid problem that is not diagnosed? What do I need to be looking for?
Well, typically it's the fatigue, unresolved fatigue. They've tried different, and it's not uncommon for my patients to walk in, my new patient to walk in with a bag full of supplements, ginseng, CoQ10, what have you, just a 5-hour energy, 10-hour energy, whatever it is. They will walk in with those bag full of supplements. Then I probably know that this is most likely a thyroid issue, and she's not getting the one supplement she needs, which is thyroid hormones. So
the having an enlarged thyroid or nodes or something like that is not necessarily an indication that there's a hidden problem.
Yeah, there's no connection between enlarged thyroid and low thyroid. In fact, you can have an enlarged thyroid and your thyroid functions can be absolutely normal. It can be high or it can be low. One has nothing to do with the other.
And people should not be panicked if they're feeling their thyroid in fine nodes, right? Those are pretty common.
Yeah, nodules are very common, especially in women, so they shouldn't panic. They should definitely go to the doctor, get the thyroid ultrasound or get it checked out. Most thyroid nodules, 90% of them or over that, 95% of them tend to be benign.
Excellent. We're going to leave it there. We hope that you've learned a little bit today about your thyroid and the fact that even though you may have a thyroid test, if they tell you your FSH is normal and you still have symptoms, don't leave it there. Keep pressing ahead because there can be help available, and the medications are very inexpensive and you can feel better. Our guest today was Dr. Ashok Kadambi from